Get your paper, get your pens, cause baby class is in session, okay?
Yeah, oh 12, that was Candace. Calm with complexion, body like heaven, and she was a dancer. Capricorn or Aquarius, but she remind me of a Cancer. She called, I would answer. Late night phone session with the camera. She tryna make a movie on the plasma. She moving like a pro, no amateur. Sex, drive, got stamina. She would ask, could I handle her? Then I'm a damager. You in need of a manager.
Hey, Rosepetalsrosefellows and Rosefellows! It is Candace Rose, and welcome back to another video. And welcome to my channel. All new people, all old people, all troll people, all hating ass hoes. Say, let me quit. I gotta stop being, I'm trying to be professional, okay? Welcome back to my channel. My name is Candace, the Candace Rose to be exact. Please like, comment, and subscribe. As promised, this is a new series alert. So as I said in my last video, I said that I wanted to start more series and do more series videos. And this is my first series video. And I'm so excited. I'm really, really excited. So as promised, I am starting a phlebotomy series. This video, I'm just going to give you a bit of my background in phlebotomy, how I started in phlebotomy, and where I am today. And I'm also going to be providing you guys what is to come for this up and coming series. A phlebotomist or a phlebotomy technician is a person who collects blood samples and prepares them for further testing. Now, the people who do the further testing, they're called clinical laboratory technicians. Those are the people that actually take the samples from us, they put it on an analyzer, or they put it on a slide, or they put it under a microscope, and they test the sample. From what I was told, I don't know if this is true or not. I tried to Google it and I could not find it. But from what I was told, phlebotomists and phlebotomy techs, or the lab industry, makes up about 50 to 70% of diagnosis, or they make up 50 to 70% of the medical field. So basically, without us, without a phlebotomy tech or phlebotomist, the doctors and the nurse practitioners are unable to diagnose or treat patients. So a lot of a patient's diagnosis and treatment is based off of either a sample of some sort. So phlebotomy technicians do not only just collect blood. Now, we physically stick you with the needle and collect the blood, but we also collect other samples. You catch my drift? We collect stool samples, urine samples, sputum cultures, wound cultures, sperm samples, and I think that's it. We don't actually do the collection. That is up to the nurse to do that. We just take the sample from the nurse and we send it to the clinical laboratory technician. So basically, we're the middleman for those type of specimens. But when it comes to that blood, baby, when it comes to that blood, it's all on us. It's all on us. The doctors and the nurse practitioners cannot diagnose, adjust a patient's medication, or treat a patient without a blood sample or a sample of some sort. And it has to be prepared properly. So that's where we step in. So let me take it all the way back. I have 15 years of total experience. I have 13 years of consecutive phlebotomy experience. So with consecutive experience, that means that from the moment that I graduated from phlebotomy school, up until a certain amount of time, up until 13 years, I never took a break. I took a break after 13 years. If y'all know, you know. If you know, you know. For like a year and a half, and I started back up again. So in total, that equals up to 15 years. I got into the world of phlebotomy through high school. So I went to Career Center, and one of my videos, this was years ago, I had made a video about my high school experience, and I how it was in high school. And I did mention that I went to Career Center when I was in high school. So I went to Career Center in the 11th grade. So I think you go to Career Center. I think that's pretty much everywhere. You go to Career Center in the 11th and 12th grade, like the last 2 years of high school. So I ended up taking a tour in the 10th grade. Then I went to Career Center in the 11th grade. Now, when I signed up for Career Center, I had no idea what I was signing up for. What I signed up for was diversified health occupations. And I can't even tell you the mind of a 16, 17-year-old what I thought what this class was going to be. Taking this class was probably one of the most lucrative and the setup for my future. So in diversified health occupations, my instructor was Stella Camuso. Hey, Miss Camuso. It ain't no shade. Last time I did check, she was still alive. She was a RN and she had her BSN, so that's a bachelor's in science. So that means that she was able to teach courses. So well, that was one of the perks of having your bachelor's in science. So when I was in this diversified health occupations, it was basically a touch in a broad spectrum into the healthcare industry. So we touched on everything, but her main focus was STNA work, which is state tested nurses assistant. So these people, they work primarily in nursing homes. Some work in a lot of them work in in a hospital setting as well. But it's called something else. They're called something else, depending on what state you live in, or what city you live in, or what hospital that you work at. The STNAs really focus on total bedside care of disabled and elderly patients. So we touched on how to feed a patient, how to make a bed, occupied and unoccupied bed. She taught us the proper way of hand washing. She also taught us vital signs and pericare, bathing, and dressing, because there is a technique it's a certain technique of dressing a patient, especially if they are paralyzed or if they're disabled in any of the extremities or anywhere in the body. It's a certain way that it's a technique that you have to learn how to dress and undress a patient as well. So she taught us a lot about that. We also touched on other things. So we touched on EKGs, and I am EKG certified. Well, I don't think I'm EKG certified anymore because I took that course, took the test, passed it, and I was technically like an EKG technician. But it's been so long. I've never done an EKG ever in my life, but I know how EKGs work. We touched on EKGs. We touched on pharmacology, which is giving injections of medications. We also touched on vet care, spading and neutering, and then we touched on breast cancer awareness, medical billing, and last but not least, phlebotomy. Now, everything was very intriguing to me. Now, when I first signed up for the class and I went to the actual class itself, I'm like, oh, heck no, I'm not doing this, because the first thing that she talked about was STNA stuff, state tested nursing assisting stuff. So she touched on, like, yeah, you're going to learn how to give pericare. You're gonna learn how to take care of elderly patients in a medical way. Baby, when I got home, I told my mom, I am dropping this class. I am not staying in this class. I'm not trying to wipe ass for a living. I'm not trying to wash no elderly old folks for a living. This was the young, immature minded Candace. My mother just basically gracefully said, Candace, I think you should stay in this class. I really think you should stay in this class and try to learn something from it. So, with her advice, I stayed in the class, and I am so glad that I took her advice on this one, because I learned a lot. I learned a whole lot when it comes to the medical field. When we got on the curriculum of phlebotomy, it was just an intro course. I fell absolutely in love with phlebotomy. I was intrigued by phlebotomy. We had to practice on each other how to stick. And y'all, when I stuck my first patient, I instantly got a rush, like, oh my God. And I hit their vein. So I feel like I had a knack for it. Before I graduated, I was working in a nursing home as an STNA because, like I said, my program was focused on STNA work. When I graduated from high school for 8 to 10 years, I was working as a STNA. I moved from Youngstown to Columbus, was still working as a STNA. When I got to Columbus, something just clicked in my head, like, you don't want to do this no more. And granted, I love, respect, and appreciate the good STNAs, not the ones that you be catching on the Teddygram cam, not those ones. But for one, it was starting to wear on my back and on my body because you have to learn how to do range of motion, and I forgot the medical term for like transferring patients. It was starting to wear on my back, and emotionally it was starting to take a toll on me because you build these relationships with patients that you take care of on a daily basis and they transition, and it was starting to emotionally affect me a lot. Then on top of that, the STNAs are underdogs and they are so disrespected. When STNAs do, they are the eyes and ears of the nurses and the doctors and the whole facility. Without the STNAs, the nursing homes will not run. And I don't care what nobody say. Without those STNAs reporting back to the nurses, when a change in a patient happens, the nursing homes will not run. So I commend all of STNAs. But for me, it was time for me to move on to bigger and better things. Not better things, but just to move on. I did some research. I found a phlebotomy school. It was like a mom and pop phlebotomy school. It was accredited. It was a mom and pop phlebotomy school, and I enrolled in phlebotomy. Now, it was a crash course in phlebotomy. Most people who go to phlebotomy schools, like, they're in school for like a year to 2 years or a year and a half. My course was 4 months. And when I tell you we hit the pavement, we took a test. It feels like we took a test every week. Every week we was taking a test. But I loved it. Now my instructor, I didn't care for my instructor at all. Actually, let me stop dancing around it. I didn't like my instructor. I despised my instructor. And if y'all know me, y'all know I got a mouth. I'm quick with the whip, and I will crack on your ass real quick. And she ain't like that. So she was about to fail me, and I think that she was trying to fail me just based off of ego. It wasn't because like I didn't know how to stick. I didn't know what I was doing. It was just based off of ego. So I had to write her a letter telling her how much I appreciated her and stroked her ego and thanking her for allowing me to be in her class and like, girl, kiss my motherfucking ass. And karma came and bit your ass. God spun the block on your ass because you ain't even a damn school no more. Y'all done shut down. Y'all shut down. He shut it down. So after I graduated from phlebotomy school, my first phlebotomy job, I worked as a phlebotomist at a plasma center. Now, in the state of Ohio, you do not have to be a certified phlebotomist in order to work in a plasma center. You could be from all walks of life. You can apply for a phlebotomy position, or it's called something else like floor phlebotomy tech or something like that, and they will train you on site. And when I tell you, working in the plasma center world as a phlebotomist as opposed to working as a regular phleb tech, totally different sides of the spectrum. When I worked as a phlebotomist at the plasma center, it really did teach me a lot. It taught me how to stick really good. Like, it taught me how to stick good because the gauge needles, and we'll talk about gauge needles further along in the series, but the needles were basically huge. Like, they're super huge because they have to fill up like these big jugs. So the bigger the needle, the more flow that you're going to get. So I was working as a phlebotomist there. I ended up getting fired from there. I don't even know how I ended up getting fired. It's so easy to get fired from a plasma center because it's so tedious and they check and double check everything. So it's easy to get fired from a plasma center. So my next job, I ended up working at a prison. I worked at a women's prison, and that is how I got a lot of my phlebotomy experience. Now, anytime you work in a prison, it's a very different world as well. You will learn how to get a blood sample based off of hard sticks. A lot of the women that, or the inmates that I would draw labs on, they were IV drug users or they were ex-IV drug users. So if you try to get blood from an IV drug user or ex-IV drug user, their veins are very hard, like literally hard, like rock hard. They're black. It may feel like it's going to be a working vein, but a lot of times it doesn't work. They move, they shift, and it just taught me how to be gentle. It taught me how to have a more sensitive touch, and it also taught me how to reposition my needle without the patient jumping out of the fucking draw chair. I worked just about everywhere. So I worked at a plasma center, I worked at a prison, I worked for LabCorp, Quest, Path Labs. I also worked as a mobile phlebotomist. And working as a mobile phlebotomist, we service nursing homes as well. So that was another way for me to gain a lot of good phlebotomy experience because elderly patients are very hard to draw. The reason why they're hard to draw is because they're elderly. It's not because of their skin sagging. It's not because a lot of elderly patients do not drink, they don't drink fluids, and they definitely don't drink water. They're extremely dehydrated, and you got to find a vein for that because sometimes it can be life or death. In this series, I am going to be starting all the way from the bottom. I'm going to be breaking down tube color, what those tubes are tested for. I'm going to be breaking down needles, needle sizes, all the equipment, how to position an arm in order to get a successful stick, how to find a good vein, and how to stick a patient and not hurt them. Because we all know that patients can be babies sometimes. And they can have anxiety too. Like they can have a bad phlebotomy experience with the phlebotomist, and it's just cemented in their head and they're just scared to get their blood drawn altogether. They can have a phobia, if you will. I'm going to be breaking all of that stuff down. I'm going to be showing you how to use a centrifuge machine. I'm going to show you how to pour off a specimen. I'm going to show you the breakdown from the after effects of spinning down someone's blood, the red blood cells from the plasma, and I'm going to be breaking it all down for y'all. And hopefully by the time I'm done with y'all are some good phlebotomists and y'all can pick up some of the slack that I be having to deal with. We need phlebotomists. There's a lot of people that are squeamish of blood. They don't like the sight of blood and they are afraid of needles. So I'm going to help y'all with all that fear, get through all that fear. I hope this video piqued your interest into the world of phlebotomy. So that's all I got. I ain't got no more. I hope this video was intriguing. I hope it piqued your interest. I hope you guys stay tuned in for the phlebotomy series. I love y'all so much. Please like, comment, and subscribe, and I'll see y'all in class.